ADHD, attention deficit hyperactivity disorder, is a neurodevelopmental disorder characterized by symptoms of inattention, hyperactivity, impulsivity, and emotional dysregulation that are excessive and pervasive, impairing in multiple contexts, and developmentally inappropriate. While the exact cause of ADHD is unknown, it's believed to be a complex combination of genetic and environmental factors. Genetics play a significant role, as ADHD tends to run in families, according to CAMS. Environmental factors, such as exposure to toxins during pregnancy or lead as a child, may also increase the risk. Let's talk more about these factors. Genetics. ADHD has a strong hereditary component, with children of parents with ADHD having a higher likelihood of developing the disorder. Drug use during pregnancy can increase the risk of ADHD in a child. Lead exposure to lead, especially in childhood, has been linked to ADHD. Low birth weight or premature birth. These factors are associated with a higher risk of ADHD. Research suggests that individuals with ADHD may have differences in brain structure and function, particularly in areas related to attention, impulse control, and activity levels. Nutritional factors. A nutrient-poor diet has been linked to ADHD, possibly due to deficiencies in essential vitamins and minerals. Other factors. Brain injury. Head injuries can, in some cases, lead to the onset of ADHD. Stress. Stress and anxiety can exacerbate symptoms of ADHD. ADHD signs in children can manifest in different ways, often involving difficulty with attention, hyperactivity, and impulsivity. These symptoms can include fidgeting, trouble staying seated, difficulty with quiet activities, and talking excessively. Children may also struggle with focus, easily get distracted, be forgetful, and have difficulty organizing tasks. Additionally, impulsivity can lead to blurted answers, interrupting others, and taking risks without thinking. Children with ADHD also may have low self-esteem and troubled relationships, and do poorly in school. Symptoms sometimes lessen with age. Some people never completely outgrow their ADHD symptoms, but they can learn strategies to be successful. While treatment won't cure ADHD, it can help a great deal with symptoms. Besides giving education about ADHD, treatment can involve medicines and behavior therapies. Early diagnosis and treatment can make a big difference in results. Let's talk about ADHD in adults. In adults, the main features of ADHD may include difficulty paying attention, impulsiveness, and restlessness. Symptoms can range from mild to severe. Many adults with ADHD aren't aware they have it. They just know that everyday tasks can be a challenge. ADHD in women often presents differently than in men, with a greater emphasis on inattentive symptoms and less overt hyperactivity. Women with ADHD may struggle with organization, time management, and focus, and are also more likely to experience anxiety and depression alongside ADHD. Furthermore, hormonal fluctuations can impact symptom severity. Common symptoms in women. Inattentiveness. Women with ADHD frequently experience difficulties with focus, forgetfulness, and disorganization. Hyperactivity, just impulsivity. While some women experience the classic hyperactive impulsive symptoms, others may exhibit more subtle forms, such as excessive talking, fidgeting, or internal restlessness. Emotional dysregulation. Emotional challenges like anxiety, frustration, and rejection sensitivity. Dysphoria are common in women with ADHD. Another very important symptom that is being ignored in women is masking symptom. Women with ADHD may develop coping mechanisms and strategies to hide their difficulties, leading to underdiagnosis or delayed diagnosis. ADHD can affect relationships, causing difficulties with communication, organization, and emotional regulation. Also, hormonal changes throughout the menstrual cycle, pregnancy, and menopause can affect the severity and presentation of ADHD symptoms. In conclusion, it is very important to deal with ADHD by proper medication and therapy as soon as you get diagnosed with it. People who have diagnosed in their late 30s or 40s and started their medication are mentioning that they stepped into a new life. Always talk to your doctors if you have any of those symptoms.